Welcome to another video. I'm going to discuss the simplest skincare. So what I did was to get a topical retinoid. I use Tretine. It's an isotretinoin 0.05. You could also use a 0.025% at the start because it probably will irritate your skin. Also, you should notice an instant result like dryness and basically dryness. Use it for spot treatment. As you can see, I have a little pimple here. It's not actually a pimple. I did dermastamp and this is the outcome. It's normal. Use Tretine on the pimple as soon as you notice it. Use it only at night, not in the morning or when you know you're going to go outside with a lot of sun, because sun degrades vitamin A. Isotretinoin or Accutane is degraded by sun. You get the point. After using Tretine and noticing the benefits, you are slowly going to understand that it's not that powerful. So you're going to take Accutane or Reducar as I did in Greece and probably in EU in general. It's over the counter. I know in the US it's a bit difficult to find. What I noticed in 16 days was all the normal side effects like tanning a bit easier, getting some sun irritation. 2 weeks in, I noticed mild aggression and mood swings, but it was very little. Then I stopped. I got rid of my dandruff for some reason. It's probably because of the lower sebum and the lower moistureness in the scalp. I got better skin. I was on top of the world. I had some pills left. I didn't need to take them. Then summer passed and tried to redo the Accutane experiment. I only took 10 milligrams per day. I took 10 milligrams for 4 days straight, and for some reason I got some heart palpitations, increased anxiety. Also, I was predisposed to anxiety, but I fixed it through some strategies I built over the years. Although on Accutane I couldn't really manage it. I was sitting and my beats per minute went from 75 to 80 to around 120 to 110, and that's why I stopped using Accutane. Then I looked more into it and found out that Accutane stays in your system for almost a week. So my plan is to take Accutane every Friday, not go out to the sun until Monday and reap the benefits from there, because I'm a hyper responder to it. I don't really want to discuss why I became a hyper responder. So anyways, you are going to have a topical retinoid used for spot treatment, at least 5 milligrams daily or 10 milligrams or once a week if you want to be safe, of oral Accutane. Vitamin C serum for the dark spots, like the eye bags or around the nose, somewhere here. Vitamin C will help glow the skin, and most of all, use an SPF 50 sunscreen or UVA, UVAB plus plus whatever, at least SPF 50 for the whole face and especially the under eyes, because the skin there is a lot thinner. Now if you want to take it to extreme, you are going to do what I'm doing for the past 2 weeks, which is take a cheap as derma stamper from AliExpress for €3. Those are the needles. You can adjust them. You are going to dip it to alcohol, sterilize it, and then do all your face. Focus more in the eyebrows and maybe under eyes. I will also put an image which will be the guide to where the millimeters should be, so not to damage the skin. And after derma stamping, of course, you are going to use a gentle cleaner, not something with salicylic acid, because it's abrasive and will damage the skin unless you have a very oily skin. So you are going to gentle clean, maybe use topical tretinoin, isotretinoin, use at least once a week oral Accutane, dermastamp once or twice a week. The day after stamping, you are going to notice some new pimples around the skin because those pimples were under the skin, and because of the stamping, you are going to elevate them to the epidermis, and then you are going to spot treat them to make them go for sure. Now, if you don't want to take Accutane, you could also oral Accutane. You could also try pantothenic acid, which is a form of vitamin B5, I think. Yes, B5. It reduces the sebum, but it's not that much. It's not sufficient enough. Why take a mega dose of vitamin B5 when you can take a small dose once a week of Accutane? That's the most amount of stuff. So cleanser, gentle cleanser, sunscreen, vitamin C serum, retinoids, oral retinoids, and if you want to push the envelope even further, get dutasteride, because dutasteride is available for around a month to a month and a half systemically. It's active life, I don't remember. I only remember the half-life, and I know that there is a DHT type 1 and DHT type 2 receptor. Finasteride has a half-life of 9 hours, I think, and you need to take finasteride every day. Also, take the risk of getting post-finasteride syndrome, while taking dutasteride targets the DHT type 1 and DHT type 2 receptor, which DHT type 1 is on the scalp. Dutasteride is a DHT blocker. It will block the DHT receptors on the skin, which is the DHT type 2, and on the scalp. So you are going to get more out of your hair and your skin, and not take the risk of getting PFS. So that was it. It's pretty cheap, like maybe €20 a month. Very easy to do. If you are going to implement the whole stack routine, do it strategically, little by little, like start using the sunscreen, cleansing, and maybe then bring the other stuff in. That was the video. I hope you enjoyed it. If you have any corrections you want to make, write them below. I'm not a guru, I'm just a guy who is into looks maxing since 2019, early 2019. And that was it, guys. Thanks for tuning in.